Okay, so you guys sent us a ton of stuff on teeth abnormalities this time.
Yeah.
We've got a PDF and like a whole audio lecture.
It's a lot to go through.
It is. So for this deep dive, we're going to kind of cut through all that and just get down to like the most interesting, most useful stuff about teeth abnormalities.
Okay, sounds good.
Cool. So we're talking everything from, like how many teeth you have to what they look like, how they're actually put together, all that.
So the whole spectrum of what can go wrong, basically.
Yeah, exactly. And we know you're busy. You don't have time to like sit there and listen to hours of lectures or read through hundreds of pages. So we're going to try to get through it all for you.
And quickly.
Yeah, quickly but thoroughly. So buckle up because we're diving into teeth abnormalities.
All right, let's do it.
So to start off, what even are we talking about here? Like, what is a tooth abnormality?
Well, it's basically any time a tooth is different from what it should be. Like, it could be you have too many teeth or not enough teeth, or your teeth are like the wrong color or the wrong size or shape.
Right, right.
So, and this can happen because of something going on in your whole body, like a syndrome, or it could be something just in your mouth.
Okay, so like there's kind of two different categories, or not categories, but like origins.
Origins, exactly, yeah.
Okay, cool. So the sources kind of broke it down into three main groups of abnormalities.
Okay.
Which I think is a good way to organize this. So
It makes sense.
first we've got number abnormalities, so that's obviously like...
How many you have?
Yeah, too many, too few.
Right.
Then we've got shape abnormalities.
So wonky-looking teeth.
Yeah, and then finally like structure abnormalities.
Yeah, so that's where like the actual makeup of the tooth is messed up.
Right, so it's not so much what it looks like from the outside, but like the actual material.
Yeah, exactly, like the enamel or the dentin.
Okay, cool. So let's start with the first one.
Okay.
Number abnormalities. The audio lecture started off with something called anodontia.
Anodontia.
Which is basically just like you have no teeth at all.
Yeah, which is like pretty wild.
Yeah, that seems pretty rare.
It is really rare, but when it does happen, it's almost always linked to this condition called hereditary ectodermal dysplasia.
Okay.
And that's like a bigger thing where you have problems with teeth and hair and nails too. So it's not just about the teeth. It's a whole syndrome.
So if you see that, it's like a red flag.
Yeah, exactly. It's like, okay, we need to look into this further.
Okay, interesting. Then the next one is partial anodontia, which is also called hypodontia, and that one's way more common.
Oh, yeah, way more common.
And that's just like missing one or a couple teeth.
Yeah, you're missing some teeth, but not all of them.
Right, and the sources mention some teeth are more likely to be missing than others.
Yeah, like wisdom teeth are the most common ones to be missing congenitally.
Oh.
Like those are the ones that are just like, nope, not going to grow.
Just never show up.
Yeah, then after that, it's the upper lateral incisor and then the lower second premolar.
Okay, the audio lecture had this funny part where he's like,
oh, yeah.
Make sure you pay attention to if it says upper or lower lateral incisor.
Yeah.
Because
it matters.
Yeah, it totally changes the answer.
Oh, yeah.
If you're like taking an exam or something.
Yeah.
Okay, and also missing baby teeth is way less common, but...
Right, but if it does happen, it's usually the upper lateral incisor again.
Daggone, that upper lateral incisor.
Yeah, that's the one that's always up to no good.
Always causing problems.
Yeah, always causing problems.
Okay, then we had oligodontia and hypodontia, which seem pretty similar.
They do sound similar.
So, like, what's the actual difference?
It's all about the numbers.
Okay.
So oligodontia means you're missing 6 or more teeth.
Oh, okay.
And hypodontia is when you're missing less than 6.
Okay, so it's like
a spectrum.
Yeah, a spectrum. That makes sense.
Yeah.
Okay, cool. So then we get to having too many teeth, which is...
Yeah, supernumerary teeth or hyperdontia.
Yeah, and these guys like to hang out in the maxilla, apparently.
Yeah, they're like party animals up there in the upper jaw 90% of the time.
90%? Compared to the...
Yeah, only 10% in the mandible, lower jaw.
Okay, so...
They like to be up top.
Interesting, okay. And then there were like all these different names depending on where the extra tooth is.
Yeah, it gets a little confusing, but
Yeah.
it's like they have their own little neighborhoods in your mouth.
Okay.
So like if you have an extra tooth right in the middle of your 2 front teeth on the top,
Yeah.
that's called a mesiodens.
Mesiodens, okay.
And if it's like way in the back, like a 4th molar,
Yeah.
that's a distomolar.
Distomolar.
And then if it's next to a molar, it's a paramolar.
Paramolar. Okay, got it.
Yeah. So it just depends on where it is.
Okay. And the audio lecture said the mesiodens is like the most common one of those.
Oh, yeah. It's the superstar of the supernumerary teeth.
Okay. And where does that usually show up?
Like I said, it's right in the middle of the 2 upper front teeth, but almost always on the backside, like behind them.
Yo, interesting. Like they're trying to hide.
Yeah, like they're shy.
Like, I'm just going to sneak in here.
Yes, exactly.
Okay. And what do they look like?
They're usually smaller than your regular teeth, and they have this cone-shaped crown and a really short root.
Okay.
And they can be like all sorts of wacky. They can erupt normally or be impacted in the bone or even be inverted, like growing the wrong way.
Wow. Okay, so lots of variation with those guys.
Yeah, they like to keep things interesting.
So if a kid has a mesiodens, like,
Yeah.
what do you do?
Well, the best time to take it out is usually right before their permanent front teeth are supposed to erupt.
Okay.
But the audio guy made a really good point. He's like, don't just rush to surgery.
Right.
Like a lot of times these methiogens don't actually cause any problems, and you don't want to put a little kid through surgery if you don't have to.
Right.
So you have to weigh the pros and cons.
Okay, so basically wait and see, unless it's like really.
Yeah, unless it's like totally blocking the permanent tooth from coming in.
Got it. Okay, cool.
Yeah.
Then the last ones for number abnormalities were natal and neonatal teeth, which are just like.
Oh yeah, those are the babies that are born with teeth.
Yeah, it's like, well.
I know, it's kind of crazy.
Yeah, so what's the difference?
Natal teeth are the ones they're actually born with. Like they're already there when the baby pops out.
Wow.
And neonatal teeth are the ones that come in during the first month of life.
Okay.
And most of the time, like 90% of the time, these are just baby teeth that have come in early.
Oh.
Like they're just super eager.
So they're not like extra teeth?
No,
Yeah.
usually not.
Okay.
But sometimes they can be loose and the baby could choke on them.
Oh, okay.
So you might have to take them out if that's the case.
But otherwise just.
Yeah, just leave them be.
Okay, cool. So that's all the number abnormalities.
On to the next category.
Yeah, let's move on to shape abnormalities.
Shape abnormalities.
Right. So the first ones were kind of the extremes. We've got macrodontia and microdontia.
Yeah, big teeth, small teeth.
Yeah, exactly. So macrodontia is just a really big tooth.
Yeah, it could be just one tooth or it could be like a bunch of teeth.
Okay.
And it could be linked to some other stuff going on in the body too, like
Yeah, the PDF mentioned like pituitary gigantism.
yeah, or hemihypertrophy, where like one side of your body is bigger than the other.
Wow. Okay.
So a big tooth could be a sign of something else.
Interesting. Okay. And then microdontia is the opposite, so a tiny tooth.
Yeah, a tiny little tooth.
And that one is often seen with hypodontia.
Yeah, which makes sense, right?
Mhm.
If you're missing some teeth, the ones you do have might be smaller.
Yeah, okay.
And it can also be linked to pituitary dwarfism.
Okay. So again, like it could be a sign of something else.
Exactly. Teeth can tell us a lot about what's going on in the body.
Wow, I never thought about that.
Yeah, that's pretty cool.
And there's one tooth that's like the poster child for microdontia.
Oh yeah, the lateral incisor, the one we talked about earlier.
Right.
So when it's really small, it looks like a little peg.
Oh, a peg-shaped lateral.
Yeah, that's the classic microdontia look.
Okay, got it. Then we had fusion and gemination, which seem pretty similar.
Yeah, they can be hard to tell apart just by looking at them. So fusion is when two separate tooth buds like glom together and become one tooth.
Okay.
It could be the whole tooth or just the roots.
Okay.
And it's really common in baby teeth, especially the front ones.
Okay.
And the important thing to remember is that even though it looks like one big tooth, it actually counts as two teeth.
Oh, okay. So you have to.
So you have to count carefully.
Got it.
Yeah.
Okay, so two buds become one tooth?
Exactly.
What about gemination?
So gemination is kind of the opposite.
Okay.
It's when one tooth bud tries to split into two teeth, but doesn't quite make it.
Oh, okay.
So you end up with this one big tooth that has like a groove down the middle or a double crown,
Okay.
but it only has one root,
Okay.
and this one counts as one tooth.
Even though it kind of looks like two?
Yeah, it's tricky, right?
Yeah, so fusion, you lose a tooth in the count, and
You
gemination.
keep the same number.
Got it.
Yeah.
Okay, cool. Then there was twinning, which is like.
Oh, twinning, that's when one tooth bud actually does fully split into two separate teeth.
Oh, okay. So it's like.
Identical twin teeth.
Got it.
Yeah.
Okay, and then concrescence, which is like.
Concrescence is when the roots of two teeth fuse together.
Okay, so it's like fusion, but just the roots.
Exactly. And it usually happens after the teeth have already come in.
Okay.
It's thought to be caused by cribing or trauma,
Okay.
and it's most common in the upper back teeth, the molars.
Got it. Okay, so those are all like kind of joining together or splitting.
Going and splitting.
Then we had densindent, which is also called densum vaginatus, which is a mouthful.
Yeah, it's a mouthful both literally and figuratively.
Because it's like a tooth within a tooth.
Yeah, it's pretty wild.
So how does that even happen?
So basically when the tooth is forming, the enamel organ like folds in on itself
Okay.
and creates this little pocket inside the tooth.
So it's like almost like a.
Like if you pushed your finger into a glove
Yeah.
and create a little indentation,
Good.
that's kind of what happens with densindent.
Okay, and why is that bad?
Well, that little pocket can be really hard to keep clean.
Oh, okay.
And bacteria can get trapped in there and cause all sorts of problems like inflammation and infection.
So it's like a little haven for bacteria.
Yeah, exactly. It's like their own little clubhouse.
Wow. Okay. And there are different types of dens in dent, right?
Yeah, depending on how far that little pocket goes.
Okay.
So type I is when it's just in the crown of the tooth.
Okay.
Type 2 is when it goes below the gum line, but doesn't go all the way through the root.
Okay.
And type 3 is when it goes all the way through the root and can even come out the other side.
Wow. Okay.
Yeah, so it can get pretty crazy.
And treatment depends on the type.
Yeah, for sure.
Okay.
Like if it's just a small type,
Yeah.
you might just need to seal it up so bacteria can't get in.
Okay.
But if it's a bigger one, you might need a filling or even a root canal.
Okay. And if the root isn't fully formed?
Then you might need something called apexification, which helps the root to finish growing.
Okay.
And in some cases, you might even need surgery.
Okay. So lots of different options depending on how bad it is.
Exactly.
Okay, cool. Then we have dens of vaginatus, which is kind of the opposite of dens in dents.
Yeah. Instead of folding in, it bulges out.
So it's like an extra bump on the tooth?
Yeah, like an extra little cusp.
Okay.
And it usually happens on the premolars in the lower jaw.
Okay.
And sometimes it can have pulp tissue in it, which can be a problem.
Why is that?
Because if that little cusp gets fractured, the pulp can get exposed, and then you're at risk for pain and infection.
Oh, okay.
And it can also mess up your bite because it's like this extra bump getting in the way.
Right. Okay.
So you might need to get it reshaped or removed.
Okay.
Or you might need a pulp cap to protect the nerve.
Okay.
Or sometimes they'll just put a little filling over it to protect it.
Okay. So again, like lots of different treatment options.
Yeah, just depends on the situation.
Okay. Then there were enamel pearls.
Enamel pearls, those are kind of interesting.
Yeah, they sound kind of cute.
They do, but they can actually cause problems.
Oh.
So there are these little bumps of enamel that form on the root of the tooth,
Okay.
usually near the gum line or where the roots split.
Okay.
And it's like the enamel got lost and ended up in the wrong place.
Oh, interesting.
Yeah, it's thought to be caused by this thing called Hertwig's epithelial root sheath.
What is that?
It's like a little blueprint that guides the formation of the root.
Okay.
And sometimes it gets a little confused and tells the enamel to form the wrong spot.
Oh, interesting. Okay, so why are enamel pearls a problem?
Because your gums can't attach properly to enamel.
Oh, okay.
So it creates a weak spot where bacteria can get in and cause gum disease.
So it's kind of like a little periodontal time bomb.
Yeah, kind of.
Okay, and what do you do about them?
Well, if they're causing problems, you might need to get them removed.
Okay.
But you have to be careful because they can sometimes have pulp tissue inside.
Oh.
So you don't want to just go hacking away at them.
Right, right.
You need a skilled clinician to remove them properly.
Okay, cool. And then there were cervical enamel extensions.
Cervical enamel extensions, those are kind of like enamel pearls. But instead of being a little bump, they're more like a little finger of enamel that extends down from the crown.
Oh, okay.
And they're usually found on the cheek side of molars.
Okay.
And again, it's thought to be caused by Hertwig's root sheath getting a little lost.
So same problem, different shape.
Exactly. And they cause the same problem because the gums can't attach properly to that enamel.
Right, okay.
So you can get deeper pockets and more gum disease.
And you might need to get them reshaped or removed.
Yeah, exactly.
Okay, cool. Then we had toroodontism.
Toroodontism. That's a fun one.
It's got a cool name.
Yeah, it means gold tooth.
Bull tooth.
Yeah, because the teeth kind of look like the molars of a bull.
Oh.
They have this really long body and a short root.
Okay.
And the pulp chamber is really big.
Okay.
And it can happen in just one tooth or a few teeth.
Okay.
And sometimes it's linked to certain syndromes,
Okay.
but a lot of times it doesn't cause any problems. In fact, it might even be a good thing because you have more surface area for the periodontal ligament to attach to.
Oh, okay.
It might actually make your teeth stronger in a way.
Interesting. So a bull tooth could be a good thing.
Yeah, sometimes.
Okay, cool. Then there was hypercementosis, which is also called cemental hyperplasia.
Yeah, that's when you get too much cementum on the root of your tooth.
Cementum, that's like the...
It's like the outer layer of the root.
Okay.
And it's supposed to be there, but sometimes it just keeps growing and growing.
Okay.
And it can make the root look really bulbous on an x-ray.
Okay.
And it's more common in the lower molars.
Okay.
And it also seems to happen more as you get older.
Okay.
And sometimes it's linked to systemic diseases like Paget's disease or acromegaly.
Okay, so again, like a tooth problem could be a sign of something else.
Exactly.
Okay. And does hypercementosis need to be treated?
Not usually, but it can make it harder to take the tooth out if you ever need an extraction.
Oh, okay.
Because the root is so big and bulbous.
Right.
So sometimes they have to cut the tooth into pieces to get it out.
Oh, wow. Okay. Then we had delaceration, which is...
Delaceration is when the tooth is bent.
Bent.
Yeah, like it has a sharp angle in the root or even in the crown.
Okay.
And it's usually caused by some kind of trauma when you're a kid, like if you get hit in the mouth.
Okay.
It pushes the tooth bud out of place.
Oh, okay.
So the root grows in at a weird angle.
Okay.
And it's more common in the front teeth.
Okay.
And sometimes it can cause problems with the way your teeth bite together.
Okay.
Or it can make the tooth look weird.
Right.
But a lot of times it doesn't cause any problems, and you don't need to do anything about it.
Okay.
Unless it's like really severe.
Okay. And then the last one for shape abnormalities was ankylosis,
Ankylosis or replacement resorption?
which is basically like the tooth is fused to the bone.
Yeah, it's like the tooth is stuck.
Stuck.
Yeah, it can't erupt anymore. And it happens because the periodontal ligament, which is supposed to be like a cushion between the tooth and the bone, gets messed up.
Okay.
And the bone just grows right up to the tooth and fuses with it.
Wow. Okay.
And it's most common in baby molars,
Okay.
especially the lower ones.
Okay.
And it can happen for a lot of different reasons, like trauma or infection or even just genetics.
Okay.
And it can be a problem because the tooth might not come in all the way, or it might be lower than the other teeth.
All right.
And if it's a baby tooth, it can mess up the permanent tooth that's supposed to come in underneath it.
Oh, okay.
So you might need to get the tooth extracted, or you might need to wait and see what happens.
Okay. So it's like a judgment call?
Yeah, exactly.
Okay, cool. So that was a lot of shape abnormalities.
Yeah, there are a lot of ways a tooth can be misshapen.
Yeah, for sure.
Yeah.
Okay, so let's move on to the last category, which is structure abnormalities.
Structure abnormalities, okay.
So the first few were all about wear and tear on the teeth.
Yeah, the sources called them attrition, abrasion, erosion, and abfraction. Those are some big words.
I know, right? But they're actually pretty simple concepts.
Okay, good.
So attrition is just wear and tear from your teeth rubbing together,
Okay.
like when you chew or if you grind your teeth.
Right.
And it can make the biting surfaces of your teeth flat or worn down.
Okay.
Abrasion is wear and tear from something else rubbing on your teeth.
Okay, so like what?
Like if you brush your teeth too hard, or if you use your teeth to open things,
Oh, okay.
or if you bite your nails.
Right. Right.
And it can cause notches in your teeth near the gum line.
Okay.
Erosion is when your teeth are worn away by acid.
Acid.
Yeah, like from acidic foods or drinks, or from stomach acid if you have reflux or bulimia.
Oh, okay.
And it can make your teeth thin and sensitive.
Okay.
And abfraction is kind of a weird one.
Okay.
It's thought to be caused by the way your teeth flex when you bite down.
Okay.
And it can cause little cracks or chips near the gum line.
Okay, so it's like a combination of forces.
Yeah, exactly. Okay, cool. And then the sources talked about how to tell the difference between abrasion and abfraction because they can both cause those notches near the gum line.
Yeah. Can be tricky.
So what's the key?
Well, abrasion usually affects multiple teeth, and it's usually on the side where you brush.
Okay.
Whereas abfraction is usually more isolated to teeth that are under a lot of stress.
Okay.
Like the ones you use to bite down hard.
Got it.
Yeah.
Okay, cool. So those were the wear and tear ones, and we get to the developmental or hereditary one.
Yeah, the ones that are more like genetic.
Yeah,
Yeah.
exactly. So the first one was amelogenesis imperfecta.
A melangogenesis imperfecta. That's a mouthful.
It is. What does it mean?
Basically, it means your enamel doesn't form properly.
Oh, okay.
And it's genetic, so it runs in families.
Okay.
And there are actually a bunch of different types of amelogenesis imperfecta.
Okay.
But they all have to do with problems with the enamel.
Okay.
So some types the enamel's too thin, some types it's too soft, some types it's the wrong color. It just depends on which gene is messed up.
Okay. And how do you treat it?
Well, it depends on how bad it is.
Okay.
Some people just need regular checkups and cleanings,
Okay.
but some people might need fillings or crowns or even veneers to protect their teeth.
Okay.
And in severe cases, they might even need dentures.
Wow. Okay. So it can be pretty serious.
Yeah, it can be,
Yeah.
but luckily there are a lot of different treatment options available.
That's good. Then there was dentinogenesis imperfecta.
Dentinogenesis imperfecta, that's another genetic one.
Okay. And that one affects the dentin.
Yeah, instead of the enamel.
Okay.
So the dentin is the layer underneath the enamel.
Okay.
And it gives the tooth its strength and structure.
Okay.
And in dentinogenesis imperfecta, the dentin is weak and discolored.
Okay.
So the teeth might look blue or brown or gray.
Oh, wow.
And they're also more prone to breaking and wearing down.
Okay.
And it affects both baby teeth and permanent teeth.
Okay.
And there's no cure for it, but there are things you can do to manage it.
Okay. So like,
Like you might need crowns or veneers to protect your teeth.
okay.
Or you might need to be careful about what you eat.
Right.
And you might need to see your dentist more often for checkups and cleanings.
Okay, cool. Then we had dentin dysplasia.
Dentin dysplasia, that's another one that affects the dentin.
Okay, so how is that different from dentinogenesis imperfecta?
Well, dentin dysplasia is more about the shape of the teeth.
Okay.
So the teeth might have short roots, or they might have really big pulp chambers.
Okay.
And it can also affect the color of the teeth,
Okay.
but it's not as severe as dentinogenesis imperfecta.
Okay.
And there are two main types.
Okay.
Type I is called radicular dentin dysplasia, and it mostly affects the roots of the teeth.
Okay.
So the roots might be short or absent,
Wow.
and it mostly affects baby teeth.
Okay.
Type 2 is called coronal dentin dysplasia, and it mostly affects the crowns of the teeth.
Okay.
So the teeth might look bulbous, or they might have large pulp chambers. And it affects both baby teeth and permanent teeth.
Yeah.
But the changes are more obvious in the baby teeth.
Okay, so it's like a milder form of dentinogenesis imperfecta.
Yeah, kind of.
Okay, cool. And then the last one was regional odontodysplasia, which is also called ghost teeth.
Ghost teeth. That's a spooky one.
It is. What is it?
So it's basically a localized problem with tooth development.
Okay.
So it usually only affects a few teeth in one area of the mouth.
Okay.
And the teeth are really small and discolored, and they might not erupt properly.
Oh.
And on an x-ray, they look really faint and ghostly.
Oh, that's why they call them ghost teeth.
Yeah, exactly.
Okay. And what causes it?
Nobody really knows.
Oh, wow.
It's just one of those mysteries of dentistry.
Okay. And how do you treat it?
Well, it depends on how bad it is.
Okay.
Some teeth might need to be extracted,
Okay.
and some teeth might need grounds or veneers to protect them.
Okay.
And in some cases, you might just need to wait and see what happens.
Okay. So lots of different options again.
Yeah, just like with all these abnormalities.
Well, that was a lot of information about teeth abnormalities.
It's a whirlwind tour.
It was. But it's crazy to think about all the different things that can go wrong with teeth.
Yeah, it really is.
And it's amazing how much we can learn about a person's overall health just by looking at their teeth.
Yeah, it's like they're a little window into the body.
Yeah,
And
exactly.
even though some of these conditions can be serious, a lot of them can be managed with the right treatment.
Yeah, that's good to know.
Yeah, so if you're ever concerned about something going on with your teeth or your child's teeth, just go see your dentist.
Yeah, they can help you figure out what's going on and what to do about it.
Exactly.
Well, this has been a fascinating deep dive into the
Mm.
world of teeth abnormalities.
Yeah, it's been a wild ride.
It has. It's amazing how something as seemingly simple as a tooth can be so complex.
Yeah, it really is.
I hope you learned something new today.
Me too.
And who knows, maybe this will inspire you to go check out your own teeth and see what you can find.
Yeah, maybe you have a hidden mesiodonts or a torodont molar.
Or maybe you're just really good at brushing your teeth and have no abnormalities at all.
Hey, that's the best case scenario.
It is. Well, thanks for joining us on this deep dive into teeth abnormalities.
Yeah, thanks for having me.
And we'll see you next time.
See you later.